Well, thank you all for being here. I'm Scott Serota, the President and CEO of the Blue Cross Blue Shield Association. I'm joined today by Brenda Schmidt, the CEO of Solera Health, and Pat Geraghty, the CEO of Florida Blue, the Blue Cross Blue Shield company in Florida, and its parent company, Guidewell Mutual Holding Corporation. Sorry, Pat. Right. You know, we've heard a lot about chronic disease and how it impacts America's health and well-being. And, you know, from my perspective, we've heard a lot of theoretical conversation about it and theoretical solutions to the problem. We're here to take a few minutes of your time and talk about what's really happening and what we're really doing in the market today as an example of how the private sector can and does intervene and try to make a difference. Time is short, so I'm going to jump right into the questions. Brenda, tell us a little bit about your vision for Solera, how you got into the business, what inspired you, and then Pat, talk about how you interact with Solera and how you use them to help solve this problem in Florida.
And so Solera Health acts like a Match.com service to connect people at risk for diabetes and other chronic conditions with organizations delivering diabetes prevention and other types of lifestyle change programs in the communities locally. And you know, patients see their doctors every day who give them advice about how to prevent or better manage diabetes and other chronic conditions. And you know, eat well, exercise more, take your medicine, sleep, lose a few pounds, and then they send them out into a world where that's not very easy. And at the same time, there's thousands of community organizations who are primarily public health grant-funded programs who have these programs that can help, and they struggle to find individuals that to participate in these programs. And Solera sits in that intersection. We work with about 24 Blue Cross Blue Shield plans to offer their members the opportunity to match them to these programs and services that can help them maintain or improve their health, where we always say live, work, play, pray, and shop. And so we've been extremely successful in that Match.com model, where if we treat patients like consumers and say, you know, based on your needs and preferences, how would you like these programs delivered in the community or digitally? You know, they'll do well, and they'll really make a difference.
Pat, how does that interface with what you're doing?
Yeah, so we are doing a number of things in Florida. One of the things we have are retail centers, where we have 20 locations around our state. And in a retail center, you can either buy individual product, you can do your member service, meaning you can actually present a claim and we'll resolve it for people face to face. And then we have clinicians there who do health risk assessments, nutritional counseling. Solera is in 11 of our retail centers across our state. We also have a partnership with an organization named Sanitas, where we've built 11 medical clinics in the state of Florida. And Sanitas works with Solera on this diabetes prevention program. And already we're seeing the people who have completed a year in that program are saving about $166 PMPM from executing the program.
That's terrific. Brenda, how do you interface with the community and the community groups? How do you bring them in? You know, there's so many unique cultures in Florida, Pat. So how does that play into this and to your work?
I think it's one of the benefits of our model because, you know, if you look at markets like Florida or Texas or California, those patient populations are extremely diverse, and there isn't a silver bullet or a single community or digital organization that can meet the needs of everyone. And so, you know, we look for those organizations that have built the capacity to deliver these evidence-based programs like diabetes prevention, but, you know, even falls prevention, tobacco cessation, other types of non-medical services that can not only provide these services in a culturally competent language-specific way, but they have already engaged in their community and they're a trusted resource. So if we can leverage those trusted local resources as a high-access, lower-cost network, I think we can make a big difference in chronic health.
I think the key to all of that is engagement. It's how to get somebody involved in the process. So what we've seen as differentiating is having reasonable goals. What happens a lot of times is people set unreasonable goals, and then failure is right around the corner. So have reasonable goals in place, have community-based partners. We use the YMCAs all across the state. And with Solera as a partner, working with the YMCAs, we're now surrounding people with reinforcing models that help them stay engaged. The whole key to this is keeping people in a process where it's an easy option and they're being reinforced in every step of the way. That's very hard for our current medical infrastructure to do. But other players like our plan, Florida Blue, like Solera, like the YMCA, like the churches that we work with, can wrap around folks that are trying to make a lifestyle change and help them get there.
And what's in it for those community groups? What do you use, and how do you keep them engaged once they start?
So I think for the community groups, many of these have been grant funded or volunteered out of a church. And through our relationships with the health plans, we can actually reimburse those hyper-local community organizations paid through medical claims. And that's really hard. I mean, these organizations don't speak payer, and the health plans certainly can't contract with thousands of hyper-local community organizations who are delivering programs with individuals who don't have any certification or credential. And so Solera sits in the middle of that to allow the patients to access this network. So they have referrals, and since we're sort of the Match.com, none of these organizations want the most people. They want the people who are going to do best in their program. And then they have a sustainable revenue model, and they can just do what they do best, which is deliver the program. And we take off all of the back office messiness around compliance and data integrity and payment so that they can just do what they really want to do and what they're good at.
Again, the key here is the hyper-local. So when Washington, D.C. thinks about healthcare, often they're trying to solve it at a minute level. What we need is a framework, and then partnerships that are hyper-local, because healthcare is very much about what's happening in the community. And the health and well-being of the community is really about all of the things that we think about when we talk about social determinants, the things that influence people's healthcare. You know, only about 20% of it has to do with the care they're receiving. Much of it has to do with what zip code do they live in.
Sure.
Lifestyle issues and services available to them. Education, particularly early childhood education. So we invest in early childhood education in a very big way in our state.
Yeah, I mean, health behavior change is inherently really personal. And I think the opportunity to ask someone, do you want to go participate in these programs in the community? Would you like a digital app? When you ask people that question, about 40% of them will prefer to go to a community location. So while there is certainly an opportunity to also network and integrate digital apps and digital therapeutics, that's not the silver bullet here. People really want that human connectedness. Loneliness is a big factor for chronic illness. So the opportunity, these programs are delivered in group settings once a week for an hour in many instances. And so this isn't something that happens cost effectively at a doctor's office. These things are things that happen effectively in a church or a pharmacy or a grocery store or a YMCA or other.
Scott, when we built our retail centers, many people said, why would you build brick and mortar?
Right.
You know, everything is going online. And what we say back is, why did Apple build Apple stores? It's about an experience. Healthcare is more expensive, it's more complicated, and it's more personal. So when we bring people into our center to have a dialogue involving Solera, involving folks from the YMCA and others, we're having a dialogue in a place that's familiar to them with the right resources wrapped around them. And what we're hearing back is our members are saying when they engage our retail centers, they are anywhere from 92% satisfied if it's a customer service issue and 97% satisfied if it's a clinical issue. Those are numbers you just don't get over the phone line.
You know, in Medicare alone, just diabetes is a $42 billion problem. You know, we only have about a minute and a half, but what kind of impact are we really having? Are we able to have, and where do you go next?
Well, I mentioned before that it's $166 per member per month that we're talking about having savings in the pilot group. So clearly we want to expand this beyond the people that are currently in the program. That pilot was done in the Medicare space, but we also have the commercial marketplace where we're starting to do some work, and we'll expand there. Florida is a very diverse place, as we were saying before. So we're like 5 different regions minimally. So we have lots of ways to try and bring that culturally competent to the people in our state, depending upon what language they're speaking, what's their cultural heritage, and how they can access the information most effectively so that it sticks.
And how about Solera? Where do you go?
Well, I mean, CMS just made the diabetes prevention program a covered Part B preventative service for all Medicare beneficiaries April 1st, because they showed that it was a $2,650 return on investment in 14 months. There are not very many other clinical programs that can show that sort of return in that time frame. So now we're looking at expanding that model into other types of social determinants of health, food insecurity, medically tailored meals, eviction, diversion, transportation. We think this model has legs to address lots of other factors that contribute to chronic illness.
It's a terrific testament to identifying a problem and at a local focus, bringing resources to bear to solve it. And we're very excited to see where you go next. Thank you both very much for your time here.
Thank you. Appreciate it.
Turn it over to Washington Post.